Okay, here's how we do the injection, okay? We're at home and my hands are clean, so I'm just gonna spray with the alcohol, and I've chosen my spot. This is my spot, okay? You see how nice and thick it is, okay? This is where I'm going. This is a thigh, the upper thigh, okay? Always make sure, see right here, I feel his bone. You don't want to go there because if you hit bone, very painful, okay? And as far as I know, Joanna has a vein coming through here. Dory does too, but you can't see it. And you don't want that. You want a nice, top beef here. Okay, right here. Okay.
Probably rubber meat.
Okay, so I feel his muscle. I feel the muscle. Okay, and what I'm going to do is I'm going to spray that area. And like I said, I'm going to use a gauze or a cotton or even a tissue. Okay, and I'm going to go right in the middle, and then I'm going to wipe outward, and that's it. Okay. In the meantime, you can show. Hi. All right, you can come closer, Dory. So I will also put alcohol over here. And remember what I did last time? I tapped it, okay? And so now I'm going to look for the little dot, okay? And I'm going to twist it away, okay? This is why I want you to have a field. You can also have a paper towel, okay? You don't need to have this, okay? So put that down, and I'm going to take my needle, my syringe, okay? So I'm 1 mil, okay? 1 mil, okay? It's thin like this. It's called an insulin syringe, okay? When it's thin. When it's thicker, it's a regular syringe. But when it's thin, it's an insulin syringe, okay? And I'm going to pull it out. A lot of people will pull in and pull out and pull in just to make sure that it works, okay? All right. That's back in the old days when stuff didn't work so well sometimes, but things work very well now. I have a 27 gauge needle, 27 times 1, just like the one that you bought, okay? And I'm going to pull it open, okay? You see, never touching the needle, never. That's why they make it like this. You don't just tear it any way. You have to tear it this way, this way. You never touch it, okay? And then you hold on to the bottom, and then you screw it on tight, okay? You don't want the medicine to leak out, okay, while you're injecting, okay? I like to keep the cover inside, okay? Professionally, that's what you're supposed to do, because if you need to recap it, you really, you want to put it right back in there like that, okay, and throw it out together, okay? All right, so I'm going to unsheath, okay? And then I'm going to take this and I'm going to pop it in here. And then I'm going to use my teeth, pull it up, pull it up, pull it up. Try to, get as less bubbles as possible, getting as much of the medicine into your syringe. Okay. Alrighty. So now you see there's a big bubble here, air pocket. I should say more like an air pocket, not a bubble. air pocket, okay? So what you're going to do is you're going to flick, and the air pocket should pop right up there. And like I said, I want to try and get as much medicine. So what I do is I pop as much down into that, this reservoir here, okay? Into the syringe, okay? All right? You're not going to get all of it, so don't try, okay? Now there's an air pocket there. You cannot use this like this. You'll kill your patient, okay? So what you do is you watch. See, what I'm doing is see, there you go. I'm pushing in, and I took all the extra medicine out and the air pocket. It should be filled up. You should not see any gap. If you're not sure, do it again. Okay, fluid comes out, you're clean. This is a good needle now, okay? There's no air in there, okay? All right, so we're ready. We're ready to inject our patient. So I'm going to take a gauze, okay, because in case the patient bleeds, okay, and then I'm going to start my injection now, okay? So we're going to go to the injection site here. Make sure you get my hand, okay? You see my hand. Dory's also being the film videographer, okay? Okay, so what I'm going to do is, I'll lay this on my lap. It's okay, it's clean. I'm going to grab a nice piece of meat, okay? All right? Now, with intention, you cannot stall. You must put it right in, okay? All right? No stalling, okay? Once you're going to do it, you do it. 1, 2, 3. Okay. Now, what I'm going to do now, remember I told you my index finger is in front? Well, right now I'm going to twist it so that my pinky is up. Pinky is in front of me now. And I'm going to pull back a little bit. I feel the pressure, and now I shall inject. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi, and we're done. I took a little bit longer because I love my husband and I want the medication. You see I'm rubbing all around it just to make sure that the medication goes in. There's no blood, okay? Nothing, okay? Okay. You're going to have a little bit of residue here, and that's okay. It's okay. There's nothing you can do about it unless you want to save it. But I wouldn't suggest you do that, okay? Okay. Now, what I'm going to do is I'm going to sheath it again. Okay, be careful not to hurt yourself. Usually in the hospital, we don't sheath it. We just put it into the sharps container. I have a container here with all of the injections, and that's it. I put it in here. I put the glass in there, the broken glass. I put that in there. I put all this other stuff in there, all the garbage, okay? All right, and this I don't have to. I cap it, and once it's filled, this goes into the garbage, okay? And that's it.
Oh, I forgot to turn it on.
What?
I'm kidding.
Okay. How was your injection, Dory?
I didn't feel anything.
Okay. All right, good. All right. Sending it on your way. Thank you. Bye.